Thanks for listening to the Granite List.Live. Today's episode is brought to you by Connect Healthcare Collaboration, where benefits marketing meets clinical advocacy to drive effective employee engagement. This is the Granite List.Live, where we explore all things human capital and employee benefits related. I'm your host, Sally Pace, and today I am joined by Justin Zimmerman, who is in sales and biz development for WorkRite Northwest. We love WorkRite. We are so proud of the things that you guys do. Justin, thanks for being here.
Sally, I'm so excited for the opportunity. Thank you for having me.
Like I said, we at the Granite List love WorkRite and your team, and we know exactly what you do. But for our audience, will you set the stage of what WorkRite is and what you all do?
So for those that don't know, WorkRite Northwest, we're an industrial sports medicine company. What that means is we bring the experts in sports medicine, athletic trainers, physical therapists. We bring them into the workplace, really where there's anybody doing heavy physical manual work, repetitive tasks, so manufacturing facilities, distribution centers, construction sites. And then we provide proactive care to the workforce. So there's a number of different things that fall underneath that: technologies, ergonomic assessments. All of it's really designed to, when an employee has that early sign or symptom, that sore shoulder, sore low back, we're providing care to them to make sure it doesn't continue to progress to the point of actually becoming an injury claim.
And can you talk a little bit about why you do what you do?
Absolutely. So our mission fundamentally is to put a dent in healthcare. We believe it's wrong to wait for someone to break and then try and fix them, which unfortunately, as we all are probably too familiar, that's how our country's current healthcare system is set up. It operates on a fee for service where someone's sick or injured, they pay a fee to then get seen or receive treatment. The incentive is on profiting, waiting for someone to be injured and then fixing them. And we think everything, really all of that, is backwards, and the incentive needs to be proactive and taking care of people before they actually have an injury.
I've heard your head cheerleader, leader in charge, Nick Patty, talk before about how so many employers look at their two plans as two separate plans, the medical plan and the work comp plan. But WorkRite, solutions that you bring to an employer really do address both of those areas. So Justin, you've talked a little bit about why WorkRite does what it does. Can you dive into a little bit more about the reason behind why you're sharing this knowledge with our audience?
Absolutely. So I think the core of what I'd love to share are there's 5 things that we've really boiled it down to what every industrial injury prevention provider should provide to ultimately allow the program to be as successful as it can be. So what are the questions, information that employer groups that are trying to vet who is going to be the best provider to take care of their people so that they can have those conversations from a more informed position? Also, we're just one company. If our mission really is to put a dent in healthcare and change it to one that's more proactive, we can't do it alone. We've got to ultimately raise the bar for all groups in this space, and the people that are going to win out are the frontline workers. Rising tide raises all boats. If all groups or vendors that you're trying to sort through who's the best one for you and your team, if they all were to provide these 5 things, everyone's going to get better outcomes. We're going to be better positioned to truly change healthcare in this country.
So let's talk about, I know WorkRite talks a good bit about this total worker approach. Are you seeing a trend in more awareness among employers?
I would say so, for sure. I think traditionally the folks that have approached us most often are the folks on the workers' comp side. It's really easy to see that direct dollar figure for a particular injury that occurred at work. But we know that the benefits side actually represents a much larger piece of the pie, and that although it is more difficult to see that direct dollar for dollar impact, that there really is with this total worker health approach and emphasis to really create a positive impact on the benefits side as well. So we've recently started having a far more folks on the benefits side reach out to us trying to understand what would this program look like, how could it provide an impact to them, how could it ultimately take care of the employees. If we're taking care of the employees well, resolving these complaints and not letting them progress to the point of becoming a larger problem, the workers' comp side and the benefits side, they will both benefit. It can be a little bit more difficult to see that direct dollar impact, but we know that that impact is happening.
Can you paint a picture for the types of workforce you engage on a regular basis?
Mhm. Yes, and it really runs the gamut. So I would say for myself, when I started with Workrite as a on-site athletic trainer, I was at a car manufacturer. There was a team of us there caring for a couple thousand workers. I've also been at sites that are they're bakeries. There's 180 employees, and we're there 8 hours per week. It really runs a spectrum of, are there enough injuries occurring? What's the frequency? What's the cost? Do we have the ability to really generate an impact without being a cost? Our desire is never being in cost to the particular groups that we work with. We understand that we do have some clients of ours that say, like, I know I don't have, if just looking at my OSHA logs, the injuries to justify having a program on site, but I know there's going to be an impact that I'm not going to be able to pin down exactly on our benefits side. I know it's worth investing in my employees and having you guys here in some capacity, whether that's 4 hours every other week, a couple hours a month. It runs the spectrum of something like that up to teams of multiple full-time people, really whatever is required to provide enough of the employees sufficient access to care so we can have a good impact. But I mentioned it earlier. What are some of the things that every group really should be providing, and what should employers ask about when you're trying to vet different vendors? What are the things that you should be asking about or getting from them to make sure that you have a program that is going to be best positioned to take care of your employees? I mentioned it a little bit, then I didn't go into it. So the first one is contract terms. It seems like the industry standard for industrial sports medicine providers is a 1, 3, or 5 year contract. We see the more optimal approach from a employer perspective and for the benefit of the employees is month to month. There's a couple reasons for that. But first, I would say if you have a current on-site vendor or you're vetting some different groups, the common pushback you'll receive is, I'll never be able to hire somebody 8 hours per week full time if they know they're on a month-to-month contract basis. Without getting into the details, I can tell you for a fact that's not true. You'll get people that'll come on site, that'll take that position and know that if they deliver, they'll stay, and if not, they'll be gone. And I think that's the common pushback. That's the common arrangement. 1, 3, or 5 years. We really feel like month to month is going to be the most ideal. And I think some of it comes down to simple human nature. A clinician, athletic trainer, PT, they want to care for people. They want to treat people. But our data is clear that if you're just sitting in an office, taking care of people, doing appointments, then yeah, you're going to have an impact. You're going to reduce injuries some. You're not going to reduce injuries quite as much as if you're out there engaging with folks proactively out on the floor, really trying to drive towards those longer term solutions. So I think that's part of it. Also, like I just mentioned, that if you're constantly delivering every month, you're on the chopping block. You're operating essentially like a perennial pilot project. You always have to be looking for new ways to drive value for that particular client. So you're not just another vendor, you're an actual truly valuable partner for them. If we can come up with some long-term solutions so folks don't have to continue to come off the floor into the office that we set up at the facility to get care, well, then it's probably the most ideal scenario. Can we equip them with the knowledge, education, maybe make some changes in how they're doing their job rotations? What are the changes we can make to ultimately stop them from having to come in and see us in the first place? I think that's a big part of it, that sense of urgency that comes with a month-to-month contract.
I love that. And I want to interrupt you for just a second because, I have the privilege of knowing that you all serve not only the 140 on the floor bakery group, but some of the largest, most well-known employers in our country. I think so often in our space as point solutions, people think we've got to go in the procurement. There's this huge process, procurement, all these demand for performance guarantees. And what I hear you saying is that, you all really do put your money where your mouth is, and that your performance literally is your guarantee. You're not locking people into these long-term contracts. And yet I don't think you have a lot of turnover in clients either. So it must be working.
No, I think it works. And I think that sense of urgency, I know myself when I was on site working with employees, I could feel that sense of urgency, and I think it was exciting. And I wasn't afraid that, well, next month, if I don't deliver, I'm going to be gone. I felt confident that, hey, I need to go out there. I need to come up with a solution that is not going to impact the facility that I'm working at. Most of these companies have multiple locations. Our people want to come up with a solution that's going to impact the facilities that we're not even at. How can we truly change and make an impact for this company that's going to benefit employees that we're not even at that facility? How can we do something like that? And I really truly feel that this sense of urgency that comes with a month-to-month contract is how you do that. And I think proof is in the pudding, as Nick would say.
Yes, absolutely. All right. Well, hit me with point number 2 that employers need to have as top of mind when they're evaluating.
Absolutely. I think this may be one of the most important ones, and I think it feeds directly into it from month-to-month contracts to its engagements per hour. So this is how many employees is that clinician engaging with every hour they're on site. So I had a conversation with a woman. She's the director of safety for a large food distribution company that we would all be familiar with. I met her at a safety conference over the summer, and she said, we've got a handful of distribution centers. We just signed a contract with another group to bring in a nurse practitioner, an athletic trainer, and a tech at all of our facilities. And I said, that's fantastic. The point of this is to be proactive, right? And she said, yes, of course. It's to reduce sprains and strains. I said, that's great. Well, tell me, how are you supposed to assess how proactive they are besides just looking at your recordable injuries? And she had no idea. And like I had said earlier, if you have a clinician just sitting in an office treating people at the facility, your injuries will go down some, but they will not go down as much as if they're truly being proactive, engaging with folks out in the work environment. So what we see as the gold standard for engagements per hour is 2.5 to 3 every hour that clinician is on site. And I think I maybe mentioned this earlier. If there's a bunch of different on-site injury prevention vendors, and as an employer, without real information on our particular industry, we can more or less seem the same on the surface. But once you get down to it, the differences are actually much larger than what it appears to most employers. So not every vendor group will go out there on the floor. Some will, some won't. The ones that do, they may say, hey, yeah, our clinician, when they're not treating people, they get out on the floor and engage with your workers, do ergonomic assessments. That's fantastic. Do they have a true metric that they're going to be held accountable to around that? We see it as 2.5 to 3. I think some group that really started this industrial sports medicine movement 30 years ago, they've mentioned their metric is 0.9 to 1.1 per hour. The reality is, engaging with one person every hour, that athletic trainer or physical therapist on site, it's an impossible metric to fail at. It doesn't really move the needle based off our experience. You really need to be pushed to get out of the office, go engage with people in the work environment. Ultimately, as a clinician, there's things that you're going to miss when someone's explaining to you what their job entails, when they're feeling this discomfort in their knee or their shoulder. There's things that you're going to miss. You actually need to get out there and watch them do their job so you can best take care of them. And so I think that metric's incredibly important for folks to ask about and be aware of.
So we're based in Memphis, and I know just in my backyard, you all do work with a global logistics carrier and a global auto parts chain. And I know how much they both watch the bottom line and scrutinize vendors. And so I would say that third pillar of data is also really important. So can you talk about what you all do on that front?
Absolutely. So if you're thinking about what data is being provided to you, the employer, folks on the benefits side, folks on the workers' comp side, from that vendor, it's really them being transparent and showing full transparency into their efforts on site. What is that clinician actually doing every time they're at your facility? I think the industry standard really seems to be an assumed savings report once a month, once a quarter, which assumed savings is assumed savings. It may or may not be accurate, but it doesn't really tell you what you need to do different the next 30, 60, 90 days. What's your plan for continuing to drive change and take care of employees? So the way we see it, the reports should be incredibly detailed, whether it's a weekly, monthly, quarterly basis, the appointments they're having. So I saw 10 individuals last month in your shipping department for right shoulder discomfort, and it was considered moderately severe. That's much more information than, hey, we treated 10 people last month in your shipping department. We can reasonably assume that we saved you X number of dollars. There's a big difference there. Also, when you're engaging with people out on the floor, are you tracking that? Do you know how many people that clinician engaged with last month where they were talking about proper lifting technique or how to promote better recovery? Really, that's how you push that industrial athlete mindset. All of these workers are doing incredibly physically demanding jobs. They're pushing, pulling, lifting, carrying, same exact movement patterns that a professional athlete does. Are we giving them the knowledge and skills that they can implement some, whether it's stretches, exercises, recovery strategies at home when they're off the clock for a few minutes a couple of times a week to better prepare their bodies for the demands of the job. And I think all of that really occurs when you're engaging with folks out on the floor, but you need to be able to track that. I think another prime example of this is looking at the data. We have a clinician at a food distribution company, and she identified that during peak season last year, this group had 9 slips, trips, and falls in this particular department. Well, we can do something about that. So this year, during peak season or leading up to peak season, she created a 4-week balance program where all the employees in that department would come in, they'd do a baseline assessment. Every person that came in to do that would get an exercise program that was specific to improving balance, proprioception. They had 9 slips, trips, and falls in that department last year. They had 1 this year.
Wow.
So that's another way of how can we use data to identify trends to better take care of the employees. And I think the detail of those reports is critical to do that.
Absolutely. All right. Contract terms, engagements per hour, data. What's next?
Conflicts of interest. So this is the fun one. So depending on who you are, this matters more to some folks than others. But I think there's a lot of different groups in our space. We fundamentally believe that you should not wait for someone to break and then try and fix them. So this is the only thing we do. Every part of our business, every department feeds into how can we be the best industrial sports medicine providers possible. There's other groups out there that do that. There's also groups that's one part of their business. They also have offsite PT clinics. They do claims management, trying to be all things to all people. And there's an appeal for certain groups. They want a group on site that can do a little bit of everything. Our belief is that if your issue is sprains and strains, then we want to be the absolute best group in that particular space. That's our sole focus. So I think also I compare that to when I have these conversations, folks that play sports. I wrestled. I was too uncoordinated to play anything else. So ask my parents. So if you talk to somebody, if you played football 4 months out of the year, wrestled 4 months out of the year, and played baseball 4 months out of the year, you're going to be maybe kind of average at 3 different sports. But if you focused on one of them 12 months out of the year, your development is going to be far greater. And I think we see businesses sort of the same way. All of our focus is towards this one particular thing. We're not trying to be all things to all people. So I think that's something that employer groups, when you're vetting different potential vendor partners, that's something worth asking about to consider. What's their focus? Is this one thing that they do or one of many?
Absolutely. All right. So that brings us to the 5th. Bring it home with this one.
Yes. So the last part is this vendor providing a truly integrated MSD solution? What I mean by this is some groups it's essentially like a staffing agency. They're going to bring you that athletic trainer, that physical therapist in whatever capacity that makes the most sense for your facility. 4 hours, 10 hours, multiple full-time people. But then that clinician is essentially doing the job of multiple different people. They're providing care to the workforce, but then they're also having to put together the data reports. They're also having to create content, best practice documents for the employees to push that industrial athlete mindset. They're having to do a bunch of different things. They have a divided focus. And I think that's common, more common than I think most folks realize. I can speak from personal experience. If I was having to create content and then also put together data reports, I'm not going to be able to care for as many employees. I'm not going to be able to have a focus on how can I get out on the floor and come up with true lasting solutions. What kind of support is that clinician getting? That's what I mean by a truly integrated solution. So do they have a content and marketing department that will help create those materials? Do they have a data team that's going to be able to look at the data that you're collecting, you're entering in every week you're on site, and trying to identify trends and help you come up with solutions that way? Does that person have an account manager or a mentor that's trying to share some lessons learned from other companies that we've been able to generate an impact? Or are you really just getting that solo clinician that's having to do everything? And I think from talking from clinicians that have been in that position, they know whether they feel that support or if essentially their time and focus is being taken away from doing what every clinician wants to do, which is just take care of people well. So how can we best support them and allow them to do what they really care about and what's going to push the needle in the right direction?
Absolutely. All right. So I know we're about out of time. We've covered the 5 things that an employer should be considering as they're looking at a potential partner for taking care of their industrial athlete. I love that phrase. Anything we can end on? Got a success story you want to share? Or
I think our focus for the year to come is really pushing this information out to as many people as possible. really trying to raise the bar truly for our particular industry. If every group in our space starts providing these things, it's going to get more competitive, and ultimately it's going to help employees be better taken care of. Employers will see the downstream benefit. We really care about changing healthcare, and we need to be a part of trying to push our particular industry and of raising the bar of what we provide to folks. And I think that's really the big emphasis we're driving for the next 12 months.
Well, that's a perfect note to end on. And as someone who is proud to sit on the sidelines watching how you all treat industrial athletes, I'd say you are accomplishing that and more. So Justin, thank you so much for coming on today. Thank you for sharing the Work-Right story and the industry story that any employer that has a workforce that needs to be cared for in this way needs to be considering, especially as we enter the new year. So we are proud to feature Work-Right. We're proud that you're part of our community at the Granite List. Thank you for joining today, and thank you to our listeners for tuning in to another episode of the Granite List.Live.
Thank you for listening to this episode of the Granite List.Live. Access our entire library by visiting your favorite podcast venue or subscribe on our site, thegranitelist.live.